Hello friends, let's talk today about preterm birth or premature birth. What exactly is preterm birth or premature birth? Women experiences labor pain before 37 weeks are said to have preterm labor, but it does not necessarily mean that they may give birth. And when they give birth before 37 weeks, they are said to have preterm birth or premature birth. It's very important for us to know about preterm birth or premature birth, as it may have long-term consequences and short-term consequences on the newborn baby. When the baby is born preterm or premature, its low birth weight, has underdeveloped organs and is very prone to infections. It may also have feeding and respiratory difficulties. And in long term, it may have certain vision disorders, learning and behavioral differences, and it may have cerebral palsy too. So we need to know about this condition, as 1 in 10 pregnant women in India may have preterm birth or premature birth. There are certain pregnant women who are at high risk for having preterm or premature birth. These women are usually those who have extremes of age, less than 17 years or more than 35 years, who are smokers, who have certain medical disorders, who have dietary deficiencies, and there are certain women who have had previous preterm births and certain women who have certain cervical diseases or any history of surgery in the operation. Also women who have had bleeding in early pregnancy, they are at higher risk for having preterm birth and they should be identified. We should also be aware of the features which indicate that we may be having preterm labor or there is a chance of having preterm birth. These features are having mild pain in lower abdomen, mild low back pain, mild heaviness or stretching pain in the lower abdomen or in back, having frank watery discharge from the vagina, or having increased in the normal discharge from vagina, and this discharge may be watery, bloody, pinkish, etc. There may be also hardening or tightening of the uterus with or without pain, and sometimes women may have a low back pain with diarrhea. These features, whenever experienced by a pregnant woman, should indicate they might have preterm labor pain, which may ultimately lead to preterm birth. It's very important for them to contact their obstetrician or nearest hospital immediately, as preterm birth can be managed and thus we can prevent the consequences faced by the baby. The management of preterm birth usually depends on the cause of preterm birth.